Should I pretend to be talking to you?
And we pretend to be talking for a minute.
All right.
We're going to wait about a minute to get started to let people get into YouTube. Typically, on these live videos, we will wait about a minute before we get into the topic, so those who arrive late or get their alerts and finally log in can actually see the start of it as opposed to coming mid-sentence. So we'll just wait here for a little bit to have our viewers join us. We'll start in about 30 seconds. Those will be good.
All right. It's all good.
About a minute in, Andy. Okay, we'll start right now.
Okay.
Hello and welcome to the Modesto Bee's live Q&A session on the novel coronavirus. I'm Brian Clark, editor of the Modesto Bee, and I'm joined here by Dr. ChrisAnna Mink, a pediatric infectious disease specialist and a clinical professor of pediatrics at UCLA. She's also the Modesto Bee's children's health reporter on a 2-year fellowship through the Report for America program, which is an initiative of the Ground Truth Project. Locally, she's supported by the Stanislaus County Office of Education and the Stanislaus Community Foundation. The coronavirus has killed more than 200 people and sickened 10,000 others in 20 countries. 90% of those cases in every death have occurred in China. The World Health Organization recently declared the outbreak a public health emergency of international concern. Dr. Mink is here to answer your questions, which can be asked via the YouTube chat window or by emailing us at local@modbee.com. That's local@modbee.com. Please know that ChrisAnna's responses should be considered information only. For specific medical concerns, consult your local healthcare professional. And ChrisAnna, first off, I think the question everyone asks is, should we be worried?
That's a great question to start. Public health officials in the United States still consider people in our country at low risk. The reason WHO has declared a public health emergency is to try and make sure if this virus does get a chance to spread, that all of the countries who might not have as robust public health system are prepared. It allows them to rally resources. But again, our health officials say the risk to citizens and people living in the U.S. are low.
What is it exactly is novel coronavirus?
It's called novel coronavirus because it's new. There are plenty of coronaviruses. Actually, 90% of adults living in the world have had some sort of coronavirus. Most of the coronaviruses cause simple colds, cough, runny nose. You're better in less than a week. The novel coronavirus, which is kind of related to SARS, if you remember severe acute respiratory syndrome and MERS, Middle East respiratory syndrome. Those are also kind of cousins in the same family, and they cause more severe illness. This novel virus is the one that just recently emerged, and we don't know yet how severe it is going to be. We're still learning.
What are the symptoms?
The coronavirus gets its name from having an outside shell that looks like a crown, little spikes on it. And those little spikes help it attach into your respiratory tree. So your nose, your throat, it gets in there. And that makes sense of the symptoms that it causes, like a common cold with congestion and runny nose, things like that. Now with this virus, it seems that in addition you get fever, can be high fever, and also the chance of it causing pneumonia.
When you say high fever, are we talking, and now everyone's normal temperature is 97.5, not 98.6. Yeah. When you talk about high fever, are we talking 101, 102, 104 in that area?
Yeah, something over 101. The official recommendation is 100.4, which is 38 if you're using the centigrade scale or Celsius scale. But over 101 for a lot of the people has been the case.
Okay, so I'm at home, it's a Monday, I have kind of a hacking cough. Yeah. Not a phlegm cough, but a hacking cough. And that's the type of cough?
It is a dry cough with this one.
It's a dry cough, okay. Day 2, I'm coughing again. It's a little bit worse. Day 3, I'm still coughing, maybe a little bit worse. At what point should I call the doctor, and what point should I kind of be, kind of freaking out a little bit?
Some of that depends on your underlying health. If you're a healthy young adult and you haven't had any other medical complications, the cough typically lasts 3 to 5 days. Some people a little longer, 7, just like any cold that you've had. If you have some problems with your immune system or underlying illnesses like asthma or diabetes, you might want to call by that 3rd day just to be cautious.
Okay. Where did this virus come from?
To the best of our knowledge, it looks like it really did emerge out of the Wuhan area in China. And it looks like it was from what they call a wet market, where there's seafood and water around and live animals. And then the virus had a chance to mutate from animals and into being able to attack humans. This particular virus shares some of the same genes as SARS. That looks like it came from a bat.
Really?
Yeah.
Okay. So how does it spread?
We're still learning. I know I keep saying that to you, but things are changing constantly. We're watching the updates all the time. The spread is definitely, I can cough on you, and this
Please
close,
don't.
yeah, please don't. In this close proximity, you would probably get the virus from me. Most of the time, it seems to be from bigger droplets, from cough, sneezing, on your hands, and then you touch your eyes, your nose, or your mouth, and it gets a chance to get in. The influenza virus, which is a very real threat to people in the U.S., can last on surfaces for 24 hours. For this virus, we're still learning how long it survives outside of humans.
Okay, so if I'm home and I have this cough, and I've got family members in the house, I should just take normal precautions as I would if I had the flu or anything else.
Absolutely. And the people visiting you, if you're sick, especially if you have a fever, you should encourage people not to come visit you. But yes, people in your house should use their standard precautions, a big one being washing your hands.
Okay, so let's go back to kindergarten.
Yeah.
Let's give everyone how do you wash your hands correctly?
Yeah. Exactly. It's one of the best things you learn in kindergarten is how to wash your hands. You want to wash all the surfaces of your hands, including between your fingers and around your nails, really well. And a good way to time it is singing the happy birthday song. That's about how long you need to really get the germs off your hands. And ideally, you can be able to do that with soap water.
Okay. What about those the alcohol-based stuff that comes out of tubes? You see people at church or wherever putting them.
If you don't have access to soap and water to wash your hands, those are fine. If there's visible soiling of your hands, get to soap and water, because the alcohol doesn't have the same punch as getting the debris off.
Yeah. And how hot scalding water, lukewarm water, medium hot water, cold water?
It doesn't need to be hot scalding water. You just really need to make sure you cover all the surfaces.
Okay. How contagious is it?
We're still learning. The worst cases are going to show up to health officials first, right? Yeah. That's why we're seeing so many cases identified increasing so quickly, is now people will know to look for it, and those who have milder illness. At this time, it seems that there's about a 2% chance of getting the spread. And that's compared to SARS, which was around 10%. But this is still evolving. Like I said, we are just seeing the tip of the iceberg. There are probably a lot of people out there with common cold kind of symptoms in China, and they're not getting to health officials yet.
There are 10,000 cases right now. I recently looked online just this morning, 7.6 billion people on Earth and counting. Are we at the pandemic level, epidemic level? Where do health officials draw that line, and just kind of where we are right now?
It's a really good question. At this moment, and this could change, it's considered an epidemic in China, which means there's an acute surge in cases, right? In that country, that's what's happened. A pandemic means that it has had a surge across a lot of countries. The other countries that are seeing coronavirus, it's not a surge yet. It's been, actually in the U.S., we have 6 cases, maybe 7 this morning. So we're not at a pandemic level. And the WHO works with health officials from all around the world when it's time to declare a pandemic.
How much of a threat is it in the United States?
Again, our public health officials are really reassuring us that we're still pretty low risk. And they're using this opportunity to remind you this is also the season of flu. We have had 54 children die from flu in the US this year and 140,000 hospitalizations. So that's a very real threat. And the things that you do to protect yourself against flu can also help protect for some of the other winter viruses. The only exception, with flu, you can get a vaccine.
Yeah. How do you differentiate between the flu and the novel coronavirus? Is there a way?
It's really hard, actually, without specific testing because the symptoms start the same. One thing with flu is it tends to be pretty abrupt when it starts. You were minding your own business at 8 o'clock this morning, and by 2 o'clock that afternoon, you feel like lying down and that you can't do anything else. But they do have a lot of overlap in their symptoms. And so when you are unsure, and you certainly, if you're at higher risk for complications, call your physician or healthcare provider.
Have you heard anything around the county, around Stanislaus County?
The good news, there's good news in talking with our local health officials is that we haven't had any cases come to us yet. And as you know, there's screening going on at the airports, and San Francisco would be our closest airport. In Los Angeles, they do have the plane that arrived in, actually it's in Riverside, and then they've had the plane that those people came from China on a chartered flight, and so they're being monitored really quickly. So far, no one is ill. In Los Angeles, they do have a handful of people that are under investigation because they've had contact or travel to China. At this point in the U.S., there aren't any cases that haven't had some link to travel to China.
Okay. We saw some people getting off the plane or near that plane in California that landed with those residents who'd come back from China. They were all wearing masks. Do masks work?
Masks have limited utility. This virus is not kept out by a mask. What a mask might help you do is not touch your mouth and touch your nose if there's something on your hands. For healthcare providers, in a situation where we may be exposed to someone who has coronavirus or any seriously contagious virus, we use specific masks called N95, and that 95 means 95% of the germs are kept out. But they're form-fitting, and actually we have to go through special fitting to have those masks. The masks that you can buy at your local pharmacy are not going to keep germs out. They mostly keep out pollutants.
These have to be the N95?
The N95 does protect you. Okay. Yeah. But also the CDC is now recommending full gear, including face shields. Even if you wear glasses, a face shield, like you may have seen in some of the pictures for Ebola, because we just don't know how contagious this is yet and how much it can spread by air, other than being in close proximity.
Sure. How do I protect myself and my loved ones?
It's just a good rule this time of year, and probably all the times, is wash your hands really well. Mm-hmm. If you're sick, stay home. Right now, you shouldn't travel to destinations like China, and actually the State Department has said not to travel to China. And again, I can't say it enough. Wash your hands, wash your hands, wash your hands. Don't touch your mouth, nose, and eyes. That's the easy surfaces for germs to get in.
Are there any risks to traveling in the U.S. or internationally? Obviously China, but what about elsewhere?
It's a good question. Right now, there's no advisories for traveling within the United States. And I think they're going to increase to 20 airports. That's the hint from the recent calls, is that they're going to do screening for travelers arriving to look for fevers. It's really difficult for screeners, though, because there are a lot of other winter viruses. So right now, traveling within the U.S. is really fine. You shouldn't travel when you're sick, though, if at all possible. If you have a fever, stay home. Don't even go to work if you have a fever, because you don't want to give anybody influenza either.
Right. Can you catch the virus from a product coming over from China?
We don't think so. They're still looking at this. The USDA hasn't issued any concerns or travel of products yet. The issue would be the humans bringing those things from Chinese products that may potentially have the virus. The one thing to keep in mind is that we don't know how long this virus survives on surfaces just yet. They were doing a lot of research with SARS to try and figure that out, but we don't know yet.
Okay. We got a question from Jimmy Swan. Hi, Dr. Mink. Do you believe the numbers given by the Chinese government can be trusted? With the videos being released of nurses in China saying the real figures are 10 times what the Chinese government is saying.
It's in my understanding that the WHO and even US public health officials are on the ground in China. So the best information that can get to us is getting to us.
Mm-hmm.
But again, there probably are more cases because remember, it's the sickest ones that are going to healthcare facilities.
Right. There might be many others.
There might be many
who
others.
Maybe don't even know they have it
Exactly.
at this point.
Exactly.
When they test for the coronavirus, what are they looking for?
The test, it's actually like a little teeny weeny hairbrush they put in the nose and scrape to look for the virus. And then they do tests for the genes. And those tests right now can only be done at the CDC. If you have a suspected case as a healthcare provider, we collect the sample, notify our local public health. So here we would call Stanislaus County, and they get it to the CDC. The CDC is working really hard to get test kits out to areas where there might be more cases, and that's just not quite ready. But right now you can still get testing. The turnaround's pretty quick. And as you know, the first case was identified very quickly after having an illness.
Yeah. That seems like a pretty long process. You get the test, you got to get it back to Atlanta.
Yeah.
How long does it take to test? Do you know that?
You get it back in 24 hours.
Okay.
Yeah.
Yeah. The so that's the way to test it. So there's no, there's not a shot or anything that someone can have once they're diagnosed.
Yeah.
What happens there once you're diagnosed?
Main thing with being diagnosed is receiving supportive care. For people that have a severe infection in their lungs, which has happened in China, so fortunately so far not in the U.S. cases, though maybe one patient is pretty ill. They might need support for breathing machine or oxygen or other ways to help their breathing through this infection. And that's so far, it seems like most of the deaths that have occurred in China are in people that have some older people that have some health problems. But again, those are the ones that are most likely to come to care. For a healthy traveler like the people in Illinois, they were in isolation and had supportive therapy, control your fever, things to keep you comfortable while the virus runs its course.
Yeah, so that was my question. What is supportive care?
Supportive care means just feeling comfortable while you're ill. So you get your fever under control. You have tissues that you need. Some people, decongestants and cough syrup work. I'm not a huge fan of cough syrup. I like honey and lemon, just like your grandma said. See, a lot of these lessons from kindergarten are still working. But that's to support them through the illness.
Okay, we got another question.
Sure.
From a viewer, from Aria Cinquantuno, and I hope I'm pronouncing that correctly. The epidemiology projection, botching that word, assumes we'll be seeing the first peak only by mid-February. Do you agree?
There are several projections of when it's going to peak. I've seen the February one, I've seen the March one, I've seen that it might be all over by May. I think it's too soon to predict, but I also want to tell you I'm not good at predicting things. I don't think I have those skills to do predictions, but there are plenty, and there are models that the World Health Organization used to try and predict. But since we're still learning just how contagious this virus is and how it's spread, it's too soon to look at predictions.
Okay, so when you talk about peaking in February or peaking in March, okay, so it peaks. Well, what then reduces it? How does it go down?
What happens actually most of the time is public health intervention. Things like we're talking about where you're washing your hands, where you're aware, where you stay home if you're sick, where people are quarantined if they've been exposed. And like in China, they pretty much have shut down travel because they are having an epidemic.
Mm-hmm. Just like SARS. SARS is,
Exactly.
you know, and MERS and everything else. It
Yeah.
reaches something, and finally, is it just getting the education out there?
That's a big part of it, and that's why the Modesto Bee is doing this, is trying to educate our community. And SARS, we haven't seen a case since 2004.
Yeah.
Exactly.
Okay.
Ebola, those, no, that one is was a big scare, but if you think about the public health measures that got put into place really quickly, it got contained.
Yeah.
And even the pandemic flu from 2009, some people were grumbling, well, the WHO over alerted us there was no pandemic. Well, they alerted everyone that there was a pandemic, and they put in measures so it was contained.
Okay. It peaks, then it goes away. Can it come back?
We don't know.
Yeah.
SARS hasn't, but we don't know.
Yeah. We talk about humans, of course. What about pets?
It's a great question, actually. Pets, because we talked about this virus coming from animals. Pets tend to get their own species infections, but there are some things that can be spread from pets to humans and from humans to pets. At this time, it doesn't appear that now that this virus has adapted itself to being a human virus, that it doesn't look like you can give it to your dog.
Okay.
Okay.
So we won't have to be teaching our dogs how to wash their hands or sneeze into their
Good
elbows.
point, yeah.
Okay, good. Linda Brawley asked us a question. Would the drugs lopinavir and ritonavir used for SARS and MERS be effective on this virus?
Linda, you're 2 steps ahead of the public health officials. Scientists are looking at that. And I'm going to use this as a plug to make sure your representatives continue funding science. Because what happened with SARS, when they were doing some of these studies, it went away. They stopped doing research. If we had that research, we would be in a better position for this outbreak.
What you've been following the CDC, they've been giving daily press briefings. And you saw one from yesterday. What's the CDC, Center for Disease Control based in, I believe, Atlanta?
Right.
What are they talking about?
The big thing now is getting more of international public health officials on the ground in China to help, because all countries have lessons that they've learned from different outbreaks. The CDC is one of the leaders in global health and global health monitoring, along with, of course, the WHO, Chinese officials, Australia. There are a lot of countries that are there to try and say, how can we look out for the world, not just our own country? And the other thing that they're working on is preparing public health and healthcare providers who are on the ground in case they have a person showing up with possible novel coronavirus. So that not only do they work to inform the public, you know, what are your risks, they're really working to inform healthcare providers and public health systems so that they're ready.
Okay. I was in the store yesterday. Somebody in front of me had a case of corona. And I texted Chris a picture last night. Here we are.
Yeah.
There has been discussion on the internet about the coronavirus. So explain all that.
Yeah, there's a lot of concern that corona beer can transmit this virus. The only thing that the virus and the beer have in common is their name, corona, which, as I mentioned, means crown. So you are not at risk from drinking beer of getting this virus.
Okay. Another question from Front Row Preps. I know this isn't science class, but can you briefly explain how an animal virus can mutate? Is it possible for all viruses to mutate?
All viruses mutate pretty much all the time. And that actually is a good teaching point. Thank you for saying you like science class. The influenza virus mutates every year. That's why you need a flu shot every year. The viruses are smarter than we are for a lot of things, and we have to keep working hard to stay one step ahead of them. This, as we've learned from the coronavirus, when the animals and humans are in close proximity, something happens where the virus can pick up some human genes, or the humans can have the chance, once it gets into humans, it has the chance to kind of change its gene structure, and then it likes the new host. It likes humans now. Viruses need living hosts for any prolonged period, and certainly to multiply. So it's all by exchanging genes with different hosts. And when animals and humans are in close proximity, such as in open markets, they get a chance to exchange genes. Essentially, viruses are promiscuous. They're always looking for someplace new.
I read something this morning that those in your field, in infectious diseases and health, let them do the worrying, and residents like me and everyone else, we can just breathe. Is that a pretty fair analogy, pretty accurate statement?
Yes, it is. People are working really hard in China, around the world. The scientists, the public health officials, the virologists, epidemiologists, all of those things, there are people working very hard to figure out why it happened, what we can do to keep it from spreading, how does it spread so that we can protect our citizens, and is there a need for a vaccine?
Right.
So there's plenty of work going on. As an individual citizen, you have responsibilities, though. As I mentioned, wash your hands, stay home if you're sick, and keep up to date on whatever the public health officials are telling you.
And now that they have that virus or forms of it, are they testing vaccines now or trying? What's happening on that side?
Yeah. There are plenty of coronaviruses that are in research labs trying to figure out what is the best way to develop a vaccine. And that's, again, a lot of that started with SARS and MERS. And some of that is certainly applicable to now. And some of the lessons we learned from those outbreaks are applicable now. So yes, there's work going on. But what happened with SARS is with the public health containment, it went away. And so the vaccine research kind of got halted. It's been at a much lower scale than it was during the outbreak.
And even with the creation of a vaccine, it has to go through all the approval processes.
It does
right?
take a while.
So, so we might just see this and.
Right, but that doesn't mean the research should end. The chance of there being another novel coronavirus in the future is real, and the research should continue.
We're coming up to our last question, unless we get some more from the audience. Where can I get the latest information about the outbreak?
I follow the CDC site pretty religiously, cdc.gov, or if you need, you can Google CDC update coronavirus. That'll get you to the site. Also, World Health Organization, I would caution people to stay away from social media as their source of information. That's where the things about it being a virus that's from the beer came from. Right. There's also some even racist comments that it's just on all Chinese people. Don't go to social media for your resources. Check the reliable sources.
Does the WHO or the CDC, do they have is there a clock or a counter that's in real time?
CDC has one, yes.
Oh, do they?
Yeah,
okay.
They do have one, real-time reporting.
So you see the numbers, the countries, and everything else?
Yeah.
Probably stay away from that,
yeah,
right?
Yeah, yeah.
Okay. Well, I appreciate you joining us. Please feel free to share the link on YouTube. It'll be on YouTube once we save it in 10 minutes. If you want to share it out, it'll also be at modbee.com. I want to thank the viewers. I want to thank Andy Alfaro, our videographer behind the camera, and also Dr. ChrisAnna Mink. We are lucky to have her in Modesto, and she's been a great benefit to us, especially on days like this. Thank you very much. We appreciate it.
Thank you.